This is the image of a man who has Bell's palsy. You can see that one side of his face looks perfectly normal, but the other side of his face is droopy. That is the side that's affected with Bell's palsy. That is the effects of some of the effects of Bell's palsy, where you see a drooping on one side of the face. We are going to talk all about this because actually this image of someone, if it happens to you or someone else, can actually be quite jarring. Now, Bell's palsy, what is it? It's a condition that causes usually temporary facial paralysis. That's where the word palsy comes from, paralysis. And usually it affects muscles only on one side of the face, but it could affect more than that. And what does it do? It makes it look like your face is drooping, like we have here. And honestly, it can be pretty scary looking, right? If you see this image in yourself or someone else, you've got to make sure they don't have a stroke ASAP, because a stroke can look like this too. And you may be wondering, how would I tell? Well, you got to go to the emergency room. That's an emergency. If anytime you see this, you can't assume it's Bell's palsy. You got to go to the ER to make sure that it's not a stroke or something more serious. Okay. Symptoms of Bell's palsy tend to come on pretty suddenly. They peak within 48 to 72 hours. Some people have mild symptoms, but other people have very severe symptoms or very sort of strong muscle paralysis. Okay. And what do we see when this happens? Well, it's difficult to make facial expressions with Bell's palsy. This gentleman probably cannot wrinkle his forehead on the affected side. Blinking may be difficult on the affected side. Grimacing, making a face, a sort of a mean face, or using other facial expressions are going to be difficult on the affected side. And also on the affected side, the face may also feel numb and heavy. Okay, so I'm going to tell you about more symptoms, but what is happening here? Bell's palsy happens when there's an inflammation and or swelling of the seventh cranial nerve. That is the nerve that controls facial muscles, okay? And other symptoms that someone may have as a result of these muscles being affected is you may get some drooling, as you can imagine, on the side of the face where the sort of mouth is turned downward. There could be dry eyes if someone can't fully close their eyelid because they've got Bell's palsy. They may have difficulty speaking, eating, or drinking. They may also have facial or ear pain, headache, loss of taste, maybe even ringing in the ears, or like a sensitivity to sounds as well. So I know you're wondering, what causes this? What causes this sort of inflammation / swelling of the seventh cranial nerve? Well, there's a number of things that can do it. Sometimes it's a virus, okay? Viruses that can do it are things like herpes simplex virus 1. Also, Epstein-Barr virus can do it. That's the virus that causes mononucleosis. But there are other things too that can still even trigger Bell's palsy. And I know you're probably saying, well, how will I know what caused it? Well, the truth of the matter is, doctors, in many cases, we don't actually ever figure out what causes it in many cases, okay? We are not always able to figure out a specific cause. Now, the good thing is that most cases of Bell's palsy will go ahead and improve, okay? Treatments, things like steroids, eye drops to keep your eyes lubricated, antivirals, etc. It's one of these things that we don't always know the cause. Now, it can last for a few weeks to 6 months. Symptoms do start to improve in 3 weeks or so, and 80% of people will recover and show no signs of Bell's palsy within 3 months, which is awesome. But it can come back later on in life, okay? And that happens in about 5 to 10% of people who have had it. The good thing is that most cases of Bell's palsy really are not permanent, okay? You may be it's probably one of the things you're wondering. I probably should have said this earlier in the video. Most cases are not permanent. Most people will get their function back, but for some people, the loss of like the facial weakness, etc., can be long lasting. Okay. The good thing is, again, most cases will go away. Okay. But once again, the symptoms that you're seeing here, this looks also like it could be a stroke. And so that's why if you ever see this, it's not your job to try to figure out what it is. You need to go to the emergency room or tell someone else to right away to make sure that it's not a stroke. Okay. This is relatively common, maybe more common than most people think. 15 to 30 people out of every 100,000 people get it every year. Okay. And 1 in 60 people will get it at some point in their life. So if you've gotten it, you get it. You're not alone. Write in the comments, by the way, if this is you. Okay. Let me know what you think about this video. I hope it's helpful to explain sort of what Bell's palsy is and just a little bit of information about it. Something I've treated multiple times throughout my career. Write in the comments. Let me know your thoughts. Share this video with someone who might be able to benefit from it. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on Facebook. Please like and follow my page. YouTube, please subscribe to my channel. Click the little bell for updates. And guys, please sign up for my free health newsletter at drjencaudle.com. And I'm on TikTok, Instagram, WhatsApp, etc. at Dr. Jen Caudle.